live. So the readings this week were focused on the idea of multicultural orientation. And over the last several years, decade or so, there's been a switch from multicultural competence to developing a multicultural orientation. So based on your understanding of multicultural competence versus multicultural orientation, what are your thoughts about the difference between the two? When you hear the word competence or competency, what does that make you think of? I know we're jumping right into the deep end and it's early and it feels really early today, right? Our bodies are still thinking it's 8 o'clock. I made getting up for the gym this morning, especially. My son didn't make it. I'll think that. Someone take a shot at it. Sure. Yeah. What's the difference between multicultural competence and having a multicultural orientation?
I think of competence as like the knowledge side of it. Like you're taking time to like understand the different, like, I guess, like cultural perspectives and like something about that culture.
Yeah.
Where like the orientation, I think, is more like the application of it, like being like humble and like having humility, cultural humility, I think is more so like the orientation, like how you come into a session because you're not going to always know everything
Yeah.
about every single person. So it's like taking this
Not
multiple
possible, right?
orientation.
So absolutely. So you can think of multicultural competence as a way of doing things. So it's that model emphasizes acquiring specific knowledge, self-awareness, and interventions that are related to particular cultural groups. So it's a skill, it's a knowledge base that you can use to do therapy in a multiculturally competent way. So if multicultural competence is a way of doing things, how would you characterize having a multicultural orientation?
I guess in that sense, a way of thinking about things.
Yeah, closer.
Yeah, I think it's more like intentional with your practice. So I think you go in with that lens already. So it informs like your how you conceptualize how you'll treat
Yeah.
maybe the interventions you'll do.
Yeah, and I think you remember we had a conversation a few weeks back. We've actually had it a couple of times about what it means to be a psychologist, right? So you can think of a psychologist as a set of competencies, I think a set of skills and knowledge that you bring to bear on the assessment or the therapeutic experience. But we talked about being a psychologist as more than that, right? It's a way of being. So ideally, the way we carry ourselves in the world. So multicultural orientation is a way of being. It's a part of being an effective, ethical, competent psychologist. It's having a multicultural orientation. So rather than a way of doing therapy, multicultural orientation is a way of being with our clients. And it recognizes that culture is kind of interwoven into all clients' views of themselves, of their presenting problems, and that the intersection of the client's culture with a therapist culture creates an incredibly complex and dynamic relationship. And you can't simply manage that complexity, that the dynamic aspects of those intersection of cultures with just memorizing a set of cultural facts, right? And to your point that you made earlier, Amanda, there's no way to actually grab into a checklist or your knowledge base, all of the kind of cultural information that would be relevant to everyone that comes through your door. It's just not possible. So let me ask you this. If you think about the distinction between a way of doing things and a way of being, why is it that outside of the fact that you can't remember it all, you couldn't possibly build all of that into your knowledge base? Why is it that a checklist of cultural competencies or skills would fall short when you're sitting face to face with a client whose identity intersects with yours in unique ways? Maybe you've already experienced it. So let's zoom in. Let's think about a particular culture. We don't even have to label which culture it is. And let's say that for that particular culture, you have the competence, right? You've got the checklist, it's locked in. They walk in, you see that they're from a particular race. Maybe you know their religious orientation, all of that. So you feel confident in that particular scenario, why might that checklist fall short?
Maybe complacency or being too comfortable.
Okay. Yeah. Like, I got this. So you go in overconfident.
Can rely.
Yeah.
Sure.
Right.
So experience.
It creates a built-in bias that's based on a set of assumptions that you're making from this internalized checklist of that particular cultural orientation. So why is that? Why is that problem? You're more likely to make a mistake. Now that seems counterintuitive though, doesn't it? And if you got the checklist down and you feel competent within that space, why might you make an error that you wouldn't otherwise make in that situation?
I feel like it prevents you from being curious about their personal experience.
I
They
love
might
that.
have
Yeah.
an assumption, but yeah, for that,
Because if you already know, then what are you looking for?
you're looking for the
Right.
checklist.
You're looking for the checklist.
It becomes inauthentic.
Yeah,
It's no
it
longer
becomes inauthentic.
a personal interaction with them. It's a meeting the marks
Yeah.
because that's what you're looking for. It becomes more testing than it does a actual person to person interaction where you're trying to get knowledge about them.
Yeah, whenever someone comes through our door and they sit with us in therapy or in assessment, it's not the culture that's sitting there, right? It's an individual. And you don't know everything you need to know about the individual based on the fact that you've got a culturally competent understanding of the culture of the individual on a larger scale. And I always go back, it is something that was shared with me quite a long time ago. And it's pertains to when you're talking about people within a given race, culture, or even political affiliation. And what was shared with me is that almost always within group variance will be larger than between group variance. What is that? When you hear that, what does that mean to you? Within group variance is almost always going to be greater than between group variance.
Well, I feel like whenever you're separating people between two groups, you're only looking at one factor. What puts them in this group and what puts them in this group. Now, when you zoom into one specific group, people within this group are going to have many diverse factors among them
Yeah.
whenever you're looking at them individually.
Yeah. You can't make group assumptions at an individual level. Right? Well, you can, and you might be right. But when we do that, when we apply a set of, let me think, cultural assumptions to an individual who comes into our office, it ignores the diversity of the individual's experience. And so, what I mean by within group variance typically exceeds between group variances that across groups we're more alike, and within groups we're more different than alike a lot of times. Does that make sense? Yeah, because everyone comes to the therapeutic experience or to life in general with their own very specific set of experiential variable, right? And so I'll use a behavioral kind of framing of this. Whoever we are at any given moment, culture, personality, behavior, affect, all of that is kind of the sum total of our history of reinforcement and punishment. So each individual experience that we have over time is what shapes us. There are cultural influences that are a part of that, right? Because how the world around us within a particular culture responds to our behavior, whether it's reinforcing of certain behaviors or punishing of others, definitely influences that. But there's still these individual experiences that when we use a multiculturally competent checklist that we're not going to account for. And I think it makes us overconfident with respect to how we believe that we understand an individual coming to receive our services, whatever they might be. And so I think it makes us more prone to error. It makes us more prone to a microaggression, an unintended microaggression. So I think while building a knowledge base, a culturally competent knowledge base is important, it's far more important to have a multicultural orientation, which is just a way of approaching the therapeutic situation in a way that's not assuming. It's going in with curiosity, it's going in with assumptions minimized and trying to understand the person and their experience and maybe how the broader cultural context within which they developed over time is influencing their current situation. So I think it's more valuable to approach multicultural situations in the context of providing clinical services from a way of being, right? It's treat everyone as an individual, not discounting the cultural influence that they're bringing to therapy, but not assuming that you know the cultural complexities that they're bringing to your services. So let's talk about the three pillars of multicultural orientation. Does anyone remember what those are from your readings? These are the pillars of having a multicultural orientation. I'll give you the first one, and then maybe it'll bring back the other two for you. The first one is cultural humility. So what is meant by cultural? It's really the foundation of a multicultural orientation.
I think that's what we were like, what Ivy was kind of talking about too, like the curiosity, the openness, the ability to like take in that new information of those new experiences for that person in their culture and not relying on assumptions or stereotypes, which pop up when you rely on things like the checklist too
Yeah.
much.
Yeah, completely agree. It's really having an other oriented, and I love the way the readings frame it. It's an other oriented interpersonal stance. And what that means for us as psychologists is that we have to regulate the natural tendency. And it is truly a natural tendency among almost all of us to view our own beliefs and our own view of the world as superior to others. So instead of trying to be the expert on a client's culture, which is that kind of multicultural competence approach, a culturally humble therapist cultivates a growing awareness of their own limitations and maintains a respectful and open mindset at all times. And to do that, that requires that constant introspective process, right? We've got to hold up the mirror. We've got to ask ourselves, okay, where am I right now in my thinking about myself in relationship to my client? So cultural humility. Does anyone want to offer one of the other pillars?
Cultural.
Were we saying the same one?
I think so.
Yeah.
Cultural comfort.
Cultural comfort. That is one of the other pillars. Absolutely. Anyone want to talk about what cultural comfort is? It's kind of self-explanatory.
Feel comfortable in yourself and in your knowledge to handle that situation and make sure you're doing it in a respectful and appropriate way for clients while also understanding you may not know all of that and being comfortable with that knowledge.
Yeah. How many of you have ever felt a little bit of anxiety as you've been in therapeutic situations with clients talking about culture? A little bit of fear because you're going to the knowledge base, right? You're going to the checklist and you want to bring something up because you think it might be important, think it might be relevant, but there's some anxiety, fear of creating a rupture if you say the wrong thing in the wrong way at the wrong time. So cultural comfort is really about being able to remain calm and to be at ease and comfortable when discussing cultural dynamics. When you're not comfortable, let me think about how to word this. So if we go back to when we were talking about the anxiety of bringing up a cultural issue, this connects to something else that we've talked about in class before. But if you're in your head, kind of working through the checklist or feeling anxiety, if you're there, where are you not? Yeah, you're not in the room. You're not being fully present in the relationship at the moment. You're in your head. And when we're in our head, we're much more likely to make a mistake. We're much more likely to say something that has the potential for rupturing the therapeutic relationship, saying something that's taken as a microaggression. And those, just subtle, indirect messages that insult or invalidate a client's cultural heritage. And obviously, that's a real risk to the therapeutic alliance. So it's getting to a place developmentally where we're comfortable, where we're not worried about moving into that space and opening a dialogue in that. That's important because if you're not comfortable, if you can't be at ease, then you can't be fully present for that therapeutic dynamic, the relationship in the moment. Okay, what's the final pillar? It kind of flows right into what we were just saying.
Opportunities.
Cultural opportunities. So cultural opportunities are the ability to actively listen for markers, like cultural markers in the session. Those are the moments where if you come in with humility and you come in with comfort and ease in having these kind of discussions, you can have a really deeper discussion of cultural issues that are warranted discussing during a therapeutic situation. So one of the examples that was used in the reading was a client's loss of faith. So let's say that you haven't really kind of delved in to cultural issues and you have a client in therapy with you who has had an extended period of depression. And over the course of the conversation in one of the sessions, the issue of feeling like the client has lost a sense of faith in God. What do you think might be, is that a potential cultural marker to enter into in session? Let's just start with a simple yes or no.
Their religious beliefs, you're saying?
Yeah. They're just depressed, struggling, sadness, sense of hopelessness. So how do you
Thank you.
why is the client saying I felt like I've lost faith, a potential opportunity? Where do you go from that statement into exploring that more deeply?
We can find out a time. I know timeline's probably not the right word, but a timeline of like what's been going on that's been exacerbating those feelings.
Sure.
That's making, or when did this start? And then you can see if there was an event. Was there a big life change? Did you lose somebody?
Yeah.
Something happened recently? Is this like a trauma response?
Absolutely. You should do that. That's that's timeline checking, right? Looking for some incident or variable that may have mediated the loss of faith. There's a layer deeper.
Well, specifically, people dealing with depression, someone's faith is usually tied to their higher meaning and purpose.
Here you go.
So,
So where do you go?
so
Next question.
if faith helps them find meaning and purpose before, I would ask them before they started experiencing depression, how was their faith helpful to them? Could they tell me a little bit more about what it is?
You used an important word. What is your faith? What has your faith meant to you? I thought your faith in a higher power, your participation in religious practice, those are cultural markers, right? And so a client feeling a loss of faith is one of those opportunities to go a little bit deeper. What does losing your faith mean to you? What does that look like? How has that been important in your life? And then you connect that deeper layer to those kind of mediating life factors. And now you've got a connection from the surface level events that have happened in life to a deeper kind of core structure for the client with respect to your culture. So cultural humility, cultural opportunities, and cultural comfort. So another question for you. Imagine a client brings up feeling isolated as the only minority in their workplace. And then the therapist responds, a lot of people with depression feel isolated. So client brings up feeling isolated in work because the client is the only minority in their workplace. And the therapist's response is, well, it's not uncommon for people who are experiencing depression to feel isolated. So that therapist response, how does that represent a missed cultural opportunity and a lack of cultural comfort? Or is it not a missed opportunity?
The therapist didn't even acknowledge the core reason why she feels isolated. She made a point to bring up that she is the only minority in her office,
Yep.
which is leading her to be isolated.
Yeah.
And saying people with depression often feel isolated is completely diminishing her feelings as a minority.
Just skips right over it, right? And I think that's where the lack of comfort is implicated, because it may be for the therapist in that situation, there's discomfort. It feels like this is a risky space for me to enter into. And while what the therapist said is true, right, it is fairly typical for someone who is feeling depressed to feel lonely and isolated, but it's definitely a missed opportunity. So how would you change your response? What might you say in response to your client saying, I'm really feeling isolated because I'm the only minority in my workplace? What's a response that would demonstrate humility, comfort, and engaging the opportunity that the client has given to you?
You need to find a way to validate her experience, even if you don't understand that. And you can even like, I may not be able to understand completely how you're feeling at that time, but I know that that must be very uncomfortable and probably very isolating for you right now. And especially if maybe she just got started in this job, especially in a new place where you have not made connections with anybody. Allow for that like validation of that moment because she maybe have talked herself into a corner and thinking that it's not that bad, or maybe this is not a uncommon thing for her where she is the only person of that ethnicity race in the room. And that can just feel so isolating, and just like letting her know that is a valid feeling to have in that moment. Being uncomfortable, being upset with that situation is okay. You don't have to be like lowering yourself mentally to like accommodate that situation. And then talk with her about, are there things that could make you feel more comfortable? Are there things that would help you in that moment or help you in other places feel more comfortable when you're faced with that situation? Is it something that we could practice? Is it helping you find other people you connect with outside of the workplace? What is needed for you to feel better about growing yourself in that space without the connections that you want right now?
Anyone else? It's almost never wrong to do this. Even if you don't know quite in the moment, if you don't know quite where you want to go with that, what's one thing you can do, one response that you can almost always offer? Foundational psychotherapy technique. Reflect it, right? So you're feeling what I just heard you say is that at work, you're feeling isolated. Maybe you're feeling lonely because you're the only one of your particular group, the only one that looks like you at work. I can see where that would feel isolating. Can you tell me more? Just reflect on it and then extend and see where that goes. Because then what's the deeper layer there that you might get to that's culturally relevant? And what I think everything you said is right, from a therapeutic standpoint. But again, think about a layer deeper.
You can probably find out how they see themselves identified and how that looks like in their lives rather than assuming.
Yep. What does that feel like? Is this a situation you've found yourself in before? Are there other areas of your life where you feel isolated because of this? How does that make you feel? There's always a layer deeper. We don't always aim a layer deeper unless it's the right timing, right? Unless the opportunity is there. Anyone else? How much you respond different? Can we agree at least that that was a missed opportunity? Yeah. Have you ever felt like you've been in that position before? And I know this requires a little vulnerability because it's again part of that introspective process. Something like this comes up. I'm not sure I want to go there yet, or I'm not sure I want to go there at all. So you kind of do this thing, bounce over maybe the most important part of the client statement. Anyone ever had that? I certainly have. Felt scared, felt vulnerable, fearful of saying the wrong thing, and it reflected my lack of cultural comfort and ease. So let's talk a little bit about some of the myths associated with cultural competence. So as we move from a multicultural competence framework to a multicultural orientation framework, there's some things we have to unlearn, some prevailing myths that have actually harmed training, which is relevant to you, and practice. And the first myth is that culturally competent therapists must possess a massive amount of specific knowledge about many different cultures. We were talking about that a little bit earlier. There's this assumption that to be competent, you've got to know everything. And if you rely purely on the competency model, it does feel that way. The second myth is that there's some magic therapy specific language that's required to treat minority clients or clients who are culturally some sort of magic code switch in a therapeutic context that's required. I mean, have you ever felt that? Okay. Oh, if I'm going to do well here, I've got to draw on the specific set of words. I've got to use a very specific kind of language if I'm going to demonstrate cultural competence in this moment. But I think that's kind of, certainly not all of the training that's happened in this space suggests that. But I think, unfortunately, that can be an implicit assumption of training in multicultural competence. To do the right thing in this moment, I've got to use the right words that are tied to the particular kind of cultural aspects of this client's culture. And it's simply not true. One of the most pervasive myths is that when we're working with cultural majority clients, therapists don't need to concern themselves with matters of culture. So if I was about to say, if I'm a Caucasian therapist, I happen to be a Caucasian. It's not if, right? And I'm working with another Caucasian client. The myth is that we're good. I don't need to worry about specific cultural issues. Why is that a myth? Why would that be inaccurate? And it touches on what we discussed earlier about within group variance.
It's only one shared experience.
Yeah. Yeah. It really not worrying about it is assuming that you share all of the same cultural tenets. And that, I was going to say likely, it's highly probable that that is a faulty assumption. I grew up in a very specific set of circumstances and born to a single teenage mom, small town, West Texas, dusty trailer. I'm in a very different place now, right? But how I grew up has absolutely influenced the course of my life. It's influenced my view of the world. But if someone is doing therapy with me and they just assume a doctoral degree, licensed psychologist, dean, faculty member, all the other checklists, like, okay, I know who this person is. Wildly inaccurate. Because again, my specific history has led to me standing in a place individually within a broader cultural context that doesn't necessarily, there will be some alignment, right, with broader cultural assumptions and understandings. But there's a lot to me as an individual that doesn't align with the broader cultural assumptions. Just like that's true for every one of you, and just like that's true for every individual, every family, every kid that we see in therapy. Another question. How might pressure to know everything about a client's culture actually hinder therapist's ability to be present and helpful in the room?
It makes us uncomfortable. Takes away from uncomfortable.
Yeah, it goes right back to the earlier discussion. If you feel like you got to know everything, knowing in your heart that you can't and that you don't takes you away from being present and actually using the knowledge and skills that you have to effectively support your client. So where do you think the kind of, for you as aspiring clinical psychologist, if you are going to develop this kind of deeper multicultural orientation, this way of being, where for you right now you think is the most important place for that to happen?
I think for me, it's like not skipping over those opportunities to engage in more like culturally relevant conversations. Like it's like how you were saying, like I think I try to come into sessions really like culturally humble and like I'm comfortable when the conversation comes up, but maybe sometimes I don't take the opportunity to create the conversation about it. And I think I'm missing out on that.
Yeah, coming in humble is kind of the opposite assumption, right? You're coming in assuming or critically knowing that you don't know everything versus coming in as an expert, right? So that's absolutely, again, the first pillar, right? It's the cultural humility is the foundation of a multicultural orientation. If you think about it from a process perspective, this is something that you're doing now weekly or biweekly, depending on your assignment, and filling out forms. It's supervision. Supervision is the place where you get to explore the discomfort. Gosh, I really had a tough spot and I was trying to be humble, but something came up and I got anxious and I skipped over it, or I didn't go. I feel like maybe I didn't go where the opportunity was. But supervision is the most crucial venue for developing a cultural orientation. What does that assume then? If you're really going to develop or use supervision as a way to facilitate the development of a multicultural orientation, it assumes that you have a supervisor with a multicultural orientation. And that's not always going to be true, unfortunately. Because if a supervisor operates as, this is too strong a word, but an omniscient expert, right? If they're not approaching it with humility, then they kill cultural humility and their supervisees, at least while you're being supervised. They may not kill it if you believe it's an important part of your development as a psychologist. But supervisors have to position themselves as culturally humble and cultural learners alongside their supervisees. So as you practice supervision with the students that you've been assigned, it's critical that you use that as an opportunity to practice cultural openness, cultural humility, not skipping over cultural opportunity, right? Because the best way to become or to enter into a way of being is to do it over. It's exposure, it's practice, it's repetition. And if you don't do that, then the supervision exercises you have now, you're taking that opportunity away from yourself. But what else are you doing? What do your supervisors do for you? They model a way of being, right? They model their way of being a psychologist. So if you don't take the opportunities you have in the supervision you're providing, not only are you not intentionally, meaningfully working on your own development, you're robbing, in a sense, robbing your supervisees of a model of being or having a multicultural orientation. And this is the time to do it because stakes will never be lower than this, right? The stakes only go up from here. Because when you're a psychologist, when you're a licensed psychologist, you're providing that supervision, all of that's on you. Everything you say, how you guide, how you mentor, how you support, how you develop your supervisees, the language you use, the opportunities you engage or fail to engage, it all sits on you as that clinical psychologist, on your reputation, on your license. So this is the time to practice. This is the time to take those risks and to develop that comfort. All right. I say it every week. I bet you all know where the time goes. Me talking a lot. So I'll just be quick. We'll kind of touch on this. There's a couple of approaches. There's the initiate, invite, and instill approach, right? So with initiation, supervisors have to be the ones to initiate those conversations about cultural identity, about power dynamics in the supervisory relationship. So you, as a supervisor, have the responsibility to initiate those. You can't passively wait for your supervisee to initiate and say, well, I need them to initiate as a part of their development. You got to jump in. You've got to initiate. You have to invite. So you have to invite your supervisee to engage in those dialogues and then instill. And this is what we were talking about just a minute ago. Instilling is being the model of a way of being a good supervisor, a way of being a psychologist, a way of being in the world that reflects a multicultural orientation. The other one is to use the ABC model. Does anyone remember what that was?
It's antecedent behavior consequence, right?
That now in
we're
the
talking about
behavioral
something
science,
here.
you're spot on. It is, right? Antecedent behavior consequence. But in this context, it's assess, build, and connect. Assess, build, and connect. So assess is helping trainees evaluate their own blind spots, but you got to initiate to do that. Build is collaboratively create a customized plan to address those weaknesses. And then connect is encouraging trainees to engage positively with culturally diverse groups. Crucially, they've got to do this from a position as an equal. It's taking the expert out of it. It's taking that bias towards our own kind of sense of our culture and our position in our education and setting that aside, right? We're not the expert in that individual. We're there to be curious. We're there to learn. We're there to explore with them as it's appropriate to the therapeutic needs, what their culture is and how that's influencing their view of the world and subsequently their set of symptoms. So not as an expert, not as a helper, but you've got to truly in that process challenge your own kind of internal biases, set the expert aside, set the helper aside and be fully present. Okay. Any questions before we take a break?